Ladies and gentlemen, welcome to our call here tonight. It's my great honor to introduce our esteemed chairman, CEO, and founder of Vollara. He has been at the forefront of our parent company, ActivePure Technologies, LLC, leading the way with an unwavering commitment to innovation and excellence. He has some very exciting news to share with us all tonight. So without further ado, I give you Mr. Joseph P. Urso. Welcome to the call.
Take this time to really share it with you directly, frame it and put some context around it, introduce you to two amazing women who really were the powerful force behind bringing us to this place, and give you some thoughts about how we can work together to just make the world a better place. So as I think you saw in the announcement, we have, in fact, it just got printed to my door today. We have been recognized in the American Journal of Infection Control, which is among maybe the preeminent journals regarding health infections and what can be done, particularly in healthcare settings and healthcare businesses, to help protect lives. And our technology, our ActivePure technology, was recognized and has passed peer-reviewed analysis demonstrating that our technology not only reduced the exposure to these infectious pathogens in the air, on surfaces, on the floors, across the board, but there was, and this is the first time that a technology anywhere near like ours has been recognized as not only demonstrating the reduction in the exposure, but the corollary reduction in infectious transmission. And we have reduced infections and at incredible percentages. And I'm going to let my colleagues share that with you. And I want to just talk it through a little bit after I let Amy and Kim speak. Amy Carenza heads up not just our medical practice, but our entire commercial practice. And many of you have had the opportunity to work with her along the way with some of the deals and opportunities you guys have brought. Amy really was the force behind ensuring that our data, our analysis, our testing, our protocols, our relationships were such that it allowed us to even get to this place. And really is at the end of the day, the impetus in the person that deserves, in my opinion, the most credit. Kim Trosh equally deserves credit. Kim is on our team here on the clinical side of the business, has an amazing background. She's an amazing person, and actually took the laboring effort and pulled in. You talk about herding cats. This was not an easy task.
This is appealing to the core of what we all care about. And what we all care about is having safe, healthy families, keeping families together, having full confidence, having just peace of mind that when you're together, it is an environment that is as safe and healthy as possible. And we've all known this for years. True story, I have had ActivePure technology in my home since 2016. So, I was already converted. But how do you convince the rest of the world, right? Like, we live in a very cynical world, and particularly because we've all seen in the past 3-4 years that less effective technologies have come to the forefront. They've made crazy claims. They've said things using studies and methodologies which you couldn't quite understand. And so we had a big job on our hands. We know ActivePure works. We know the difference ActivePure can make in people's lives, but we needed to prove it to a level that the rest of the cynical world appreciated for the significance of what it is capable of doing. And that's really what this publication is about. So Joe held up a copy of it. I will say the article in the American Journal of Infection Control, it's not exactly light reading, but hopefully you all have a chance to go and check out the article. It's easy to access, it's online, and certainly share the article as you see fit. but this is the gold standard of what any sort of scientific discovery needs. It needs to have a design of study that the scientific community agrees is rigorous. It agrees that it's a difficult design of study. And then it needs to have enough time of evaluation and observation. So then again, the scientific world says, these people didn't get lucky. This is more than chance. This is really something. They've really done something. And so to me, that's what this article is all about. When you dig into the article, I want you to think of it in two important ways, okay? Because I know it's really a medical article. It's intended for medical audiences, but it absolutely translates to everybody on this phone, and I'll tell you why. Number one, when we went into ICUs, we knew without a doubt any infections that occurred for the patients in those ICUs, they got them from the hospital, right? Because we've heard it all. You go, I know a lot of people have sold into schools, you've sold into small businesses. Well, kids aren't at school 24/7. People aren't at the bakery 24/7. We're not at our jobs 24/7. If you are a patient in an ICU, you are there 24/7. So when mistakes happen, when a hospital is unable to effectively clean and disinfect their environment and a mistake happens, it shows up as an infection. That's number one. Number two, inside of an ICU, remember this, those hospitals have already invested in ventilation and filtration to a degree that is greater than any commercial space you ever step into. So hospital ICUs, they have HEPA filtration. So it's like a MERV 20. Most people in their homes, they have MERV 4s. So you have really, really dense filters, first of all. And then from a ventilation standpoint, you're typically having anywhere from 12 to 20 air changes per hour, with around 60% plus of those air exchanges being 100% outdoor air, right? So really high levels of ventilation, really high levels of filtration. And guess what? It's not foolproof. A lot of infections happen. So we walked into an environment where the stakes are as high as they could be, but also the protection is as high as it could be. And yet there were still a lot of infections occurring. And what we knew was, if this technology could go into that environment and solve for that very real and that very dangerous gap, that we know at that point, we've got a story that translates not only to medical markets, but it translates to all markets, because what we're talking about is certainty. Certainty of being able to eliminate these pathogens with the speed and with the effectiveness to arrest these infections from occurring. And that's what we want when we're talking to any potential customers, whether they be a residential buyer or a commercial buyer. You don't want to prevent the flu every other time, every third time. You want to prevent that flu every time. You want to prevent COVID spreading every time. And so truthfully, going into an environment where they're already doing as much as they possibly can to prevent infections, and yet infections are still occurring, but it was Active Pure that was able to go in and fill that gap. The last point I want to make is about time, right? What is truly standing the test of time? And when Kim and I got started on this research project and our analysis, if you go in and read the article, you'll see we have over 60 months of data that we have compiled. So there's at least 33 months of data that is essentially since the technology had been installed and just observing what the environment is like after the technology was implemented. And so we went back in time, that same amount of time, to have not only a comparison of before and after, but a sustained comparison of before and after. Because as anybody knows you can have a change in the environment. You can even get lucky for a week, maybe for a month, maybe for a couple of months. But in both of these ICUs where this technology was installed, we reduced hospital-acquired infections 70%, and we sustained that reduction in aggregate across both hospitals for over 30 months. So we're performing outside the realm of chance, and we truly are standing the test of time. And I think, to me, you put all of that together, right? That's a pretty powerful story of not only time, but then also environments where the stakes are high, but so are the investments in the environment. And yet we're still filling that gap. You put all of that together and you can see how now, yes, we really have put forth a level of research and analysis that the rest of the world is paying attention to, and that the scientific community is saying, you know, this really is different. This really is something. And this science has not only met our scrutiny, but it's something that the rest of the world needs to see, because we believe the contributions that are possible from this technology need to be distributed. The world needs to know about.
Okay, so the Cleveland Clinic study is still going on because of the COVID information. They got behind in the number of surgeries they could do because they were prevented from doing surgeries, which is really unfortunate because some of the people needed their surgeries. But we're still waiting. We're going into our 4th year, which is in itself remarkable. It's so hard to tell. Surgical site infections are very different in many ways than those infections that you would get in an ICU unit. And there are lots of variables, but I'm confident that we're making a difference, and hopefully we'll get those results soon. But we're still waiting. They won't tell us anything because it's a randomized double-blind clinical trial, and those are the rules. We're in the dark.